Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Screening tests. Investigations of congenital adrenal hyperplasia. Screening tests include 17-hydroxyprogesterone levels. In 17-hydroxyprogesterone levels, there is if it is less than 300 nanogram per deciliter, then it is not a case of congenital adrenal hyperplasia. If 17-hydroxyprogesterone levels are between 300 to 800 nanogram per deciliter, then you should do the diagnostic test. If 17-hydroxyprogesterone levels are more than or equal to 800 nanogram per deciliter, then we should do definitive diagnosis for congenital adrenal hyperplasia. Diagnostic test for congenital adrenal hyperplasia. Adrenocorticotropic hormone stimulation test. Within half an hour, first you should give adrenocorticotropic hormone. After giving adrenocorticotropic hormone, within half an hour, if you see that there is increased 17-hydroxyprogesterone levels to more than or equal to 1500 nanogram per deciliter, then it is congenital adrenal hyperplasia. Other investigations which can be done are investigations to perform is karyotyping can be done. You will have to measure the electrolytes. Ultrasonography is done to assess the internal genitalia. Luteinizing hormone, follicle stimulating hormone, and estrogen and testosterone levels are also measured.
Ultrasound is done for internal genitalia. Luteinizing hormone, follicle stimulating hormone, estrogen and testosterone levels are also measured.
thank you and thank you for watching.